Hey there, I'm Doc Schmidt and I'm a GI doctor. Today we're going to talk about IBS, or Irritable Bowel Syndrome. IBS has long been poorly understood, and unfortunately many who suffer from it have in the past largely been ignored or written off. And that's largely because it's a very difficult disease to diagnose and to treat. IBS causes abdominal pain along with what GI doctors like to call altered bowel habits. That can mean diarrhea or constipation or both. What makes IBS difficult to diagnose though is that there aren't any objective tests or studies that we can use to diagnose it. Blood tests, stool tests, CT scans, EGDs, colonoscopies are all normal in a patient with IBS, by definition. In fact, if you have abdominal pain or diarrhea and any of those tests I described are abnormal, that points us away from IBS as a diagnosis. Instead, we have to rely mainly on a patient's description of their symptoms to diagnose IBS. We use the Rome-4 criteria to do this. These criteria define IBS as recurrent abdominal pain that occurs at least once per week over a span of 3 months. That pain has to be related to bowel movements in 2 of 3 ways. One, it can be related to defecation, meaning that pooping makes it better or makes it worse, or the pain is associated with a change in stool frequency or stool form. Now, IBS is actually pretty common. Around 11% of the entire global population is estimated to meet these criteria and have IBS. However, there's a broad range of how IBS can manifest. It can be anything from a mild annoyance to a severe, debilitating disease that impacts your quality of life severely. IBS is thought to be caused by abnormalities in the brain-gut connection and hypersensitivity in the gut. The gut has the most nerve cells of any body system outside of the brain and spinal cord. That's why when you're nervous, you often get diarrhea or have belly pain or feel butterflies in your stomach. People with IBS have a hyperactive brain-gut connection where even mild nerve impulses that might not bother an average person will cause significant symptoms in someone with IBS, manifesting as abdominal pain or diarrhea or constipation. Now, this could be caused by anxiety, whether a person is aware of their anxiety or not. It can be caused by eating certain foods that might stimulate a little bit more gas production in the intestines than normal, or it can even be caused by a trigger we don't really know about yet. Although it's a nebulous disease that we don't fully understand, we're gradually learning more and more about IBS, and we can offer treatments beyond just telling people to treat their anxiety. We have as-needed antispasmodics to help relax the gut. TCAs or tricyclic antidepressants can help dull that hypersensitivity of the gut in patients with IBS. Avoiding food triggers can really help minimize symptoms, especially foods that contain FODMAPs. We can even use hypnosis or gut-specific psychotherapy to help you train your gut and help you manage those symptoms that come with the associated hypersensitivity. Now, we don't have a complete cure for IBS yet, but we understand it a lot better. We know that it's not all in your head, and we have treatments that can make it more tolerable. Please talk to your doctor if you think this might apply to you. Thanks for watching, and please comment below if you have any questions about IBS or have any suggestions for what disease I should cover next. Thanks.